Cellular event of inflammation is divided into six categories: margination, rolling, then we have adhesion, then we have transmigration, chemotaxis, and phagocytosis. If you look at the process of margination, we see that during the process of margination, the RBCs aggregate into a stack of coin appearance, which is also called as rouleau. When the RBCs stack amongst each other over the venule side, that is going to result in pushing of the neutrophils towards the periphery from the central axis column, and this is called as margination. Now this picture shows the accumulation of the RBCs which are forming the rouleau, and since the RBCs occupy the central axis of the venules, that is going to push the neutrophils towards the margin of the venules, which is called as the margination. The neutrophils have adhesion molecules which are called as L-selectins. Similarly, the endothelial cells have receptors which are called as P-selectins or E-selectins. When these molecules, the selectin molecules, are activated by the tumor necrotic factor or interleukin 1, then there will be activation of these adhesion molecules. Now, once there is activation of these adhesion molecules, there will be interaction of the P-selectin and E-selectin with another molecule present over the surface of the neutrophil, which is called as Cellular Lewis X. Now, the interaction between the Cellular Lewis X modified glycoprotein present over the neutrophil and the endothelial cells, P-selectin and E-selectin, is going to result in the process which is called as binding. Now, this binding is very temporary, and this binding is followed by release of the interaction between these two surface receptors, which is going to result in detach. And again, the detach is going to be followed by the binding of the surface molecule receptor over the neutrophil, which is called as the Cellular Lewis X modified glycoprotein with the L-selectins or P-selectins, and that is again going to result in binding. So as we see that the process occurs alternatively in the form of binding, detach, binding, that is going to result in the process of rolling. The third step of cellular event of inflammation is adhesion, which occurs by the activation of the neutrophil adhesion molecules with the endothelial adhesion molecules. Now, unlike the process of rolling, the adhesion molecules have a longer period of interaction amongst each other. The neutrophil adhesion molecules, mainly the beta-2 integrins, interact with the endothelial adhesion molecule, mainly the intercellular adhesion molecule. Now, before this interaction between these neutrophils and endothelial adhesion molecule occur, these molecules should be uh, activated. The beta-2 integrins are activated by the mediators C5a and leukotrienes B4. Similarly, the ICAM or the intercellular adhesion molecules are activated by interleukin 1 and tumor necrosis factor. The ICAM or intercellular adhesion molecules are present over the surface of neutrophils and macrophages, and they bind to activate the beta 2 integrins present over the surface of the neutrophils or the macrophages. Similarly, the VCAM or the vascular cell adhesion molecules after activation binds to the beta 1 integrins. The VCAM or vascular cell adhesion molecules are present over the surface of eosinophils, monocytes, and lymphocytes. The fourth step is the transmigration, which is also called as diapedesis. Now, during the process of diapedesis, the leukocytes move out of the blood vessels to the interstitium. Then comes the fourth step, the transmigration, during which three important steps do occur. And the first one is the endothelial cell contraction by histamine that is going to result in increased vascular permeability. Second is there is going to be the interaction between the endothelial cells PCAM with the neutrophilic PCAM. Now, since both these receptors are the same, that is PCAM or the platelet endothelial cell activation molecules, we call them homophilic adhesion molecules interaction. Now, the third step in transmigration is the uh, digestion of the basement membrane. Now, we know that the basement membrane has type 4 collagen, so the enzyme that is required to digest the basement membrane is collagenase. Now, during the process of transmigration, not just the neutrophils that moves out of the blood vessel into the interstitium, but along with the neutrophil, there will be movement of the fluid-rich in proteins, which is called as exudates. Now, here this slide shows the increased vascular permeability and the movement of the neutrophil outside from the blood vessel after the interaction between the similar receptors present over the surface of the neutrophil and the endothelium cells. And the name of the receptor is PCAM1 or CD31. The process of movement of neutrophils towards the chemical gradients is called as chemotaxis. Now, during the process of chemotaxis, some of the chemotactic mediators, mainly C5a, leukotrienes B4, uh, interleukin 8, kallikrein, so these bind with the neutrophil, and when the chemotactic mediators bind to the neutrophils, that is going to result in release of calcium. Now, the release of calcium is going to result in the increased motility of the neutrophils. The last step is phagocytosis. The phagocytosis can be divided into opsonization, ingestion, and killing. The process of attachment of the opsonins like IgG, C3b, and C-reactive protein over the surface of the bacteria is called as opsonization. And once the bacteria are opsonized, that is, they are coated by the opsonins, they are now ready to get engulfed by the neutrophils or the macrophages via the attachment to the membrane receptors present over the surface of the neutrophils. The second process of phagocytosis is ingestion, during which the neutrophils engulf the bacteria and get it entrapped inside a phagocytic vacuoles. After the formation of the phagocytic vacuoles, a connection between the phagocytic vacuole or the phagosome with the lysosome is formed, and the connection is called as phagolysosome. Now, after the formation of the phagolysosome, the lysosome can empty its hydrolytic enzymes into the phagocytic vacuoles. The last step of phagocytosis is bacteria killing, and the process of killing could be oxygen dependent or oxygen independent. During the process of oxygen dependent myeloperoxidase system, several steps can occur. For example, NADPH oxidase induced conversion of the oxygen to the superoxide free radicals. And during the process of the formation of the superoxide free radicals, there is the release of energy, which is called as the respiratory or oxidative burst. The superoxide thus formed can get converted to hydrogen peroxide by the enzyme superoxide dismutase. The hydrogen peroxide thus formed can get converted into hydroxyl free radicals by the implication of iron. The hydrogen peroxide can combine with chloride in the presence of enzyme myeloperoxidase to produce bleach, which is also called as hypochlorous free radicals. Similarly, uh, nitric oxide, which is produced from the arginine, can bind with superoxide in the presence of enzyme nitric oxide synthase to produce free radical peroxynitrite. Uh, Now we come to the another topic, which is the killing by without implication of oxygen. That's why we call it oxygen independent system. During the process of oxygen independent system, the enzymes are used to kill bacteria. The enzymes are usually present over the granules of the leukocytes. So that concludes the cellular event of inflammation. And now we go for a brief introduction on applied pathology of cellular events of inflammation. The neutrophils that are adhered to the endothelium does not participate in peripheral blood neutrophil count. So anything that increases the activation of adhesion molecules will decrease the peripheral blood count. Similarly, anything that inhibits the activation of adhesion molecules like the ICAM or the beta 2 integrins will increase the peripheral blood neutrophil count. For example, catecholamines, corticosteroids, and lithium, they inhibit the activation of adhesion molecules. So if there is inhibition of the activation of the adhesion molecules, the WBCs or the neutrophils are freely floating in the peripheral blood. That's why there is going to be the neutrophilic leukocytosis. And unlike the uh, process, we have the endotoxins which enhance the activation of the adhesion molecules. So if it results in more activation of the adhesion of the neutrophils, that is going to decrease the peripheral blood neutrophil count and is going to result in neutropenia. So endotoxins result in neutropenia. We have two types of leukocyte adhesion deficiency disorder, which are autosomal recessive disorders. The type 1 is due to deficiency of the beta 2 integrins, and type 2 is deficiency of endothelial cell selectins. Due to leukocyte adhesion disorder, deficiency disorder, we can have delayed separation of the umbilical cord because the separation of the umbilical cord requires the activation of the neutrophilic enzyme. The patient can have poor wound healing, gingivitis, and can have neutrophilic leukocytosis. The next defect is opsonization defect, and the disorder is called as Bruton A gamma globulinemia. Here, the pre-base cells cannot get transformed into immature B cells because there is mutation defect of the Bruton's tyrosine kinase gene. Now, if the B cells cannot get mature mature enough to form plasma cells, antibody cannot be formed, and one of the opsonines are the antibody ICZ. Then we have another defect which is called as the ingestion defect. The ingestion defect is because there is defect in the microtubule formation. If there is defective microtubule formation, phagolysosome or the connection between the lysosome and the phagosome cannot form. Now, if the phagolysosome cannot be formed, the hydrolytic enzyme or the lysosome cannot get access to the phagocytic vacuoles containing the bacteria. The celiac Higashi syndrome uh, or the defect in microtubule function disorder can also manifest with neutropenia because these people have intramedullary destruction of the neutrophils and giant granules in leukocyte because the granules fuse from Golgi apparatus. We can have defective hemostasis because there are abnormal dense granules in platelets. There is albinism because there is formation of giant melanosome, and this giant melanosome trap the melanin. And lastly, we can also have peripheral neuropathy, and because the peripheral neuropathy results in abnormal giant granules and lysosomes in Schwann cells. Next is defective oxygen impure system disorder, under which we have chronic granulomatous disease, where we can get to see the granulomas formation. Now, this is due to the NADPS oxidase defect and is either X-linked or autosomal recessive. The patient with this kind of disorder, they have recurrent infection with Staph aureus, Pseudomonas, Serratia, Nocardia, and Aspergillus. If nitroblue tetrazolium test is done, the test will come to be negative because NADPS oxidase is required to convert the oxygen to superoxide. The last disorder is impure deficiency disorder. This is because there is defective conversion of hydrogen peroxide to bleach. Now, if a person has impure deficiency, most of the time they are asymptomatic but can have increased risk for candida infections. The nitroblue tetrazolium test is normal as the NADPS oxidase system is intact in this case.